So this is the third video for this topic, which is dehydration. So dehydration is a condition that can affect patients of all ages. So, however, they are more common and severe in population of extreme ages. So whether you are very young or very old, so usually dehydration is more severe. So there are many causes of water deficit or many causes of dehydration. In other words, whether you decrease intake, that means you do not take enough water, or you have excessive loss. That means you're actually drinking enough water, but somehow your body keep losing more water than expected. So there are a lot of examples of diseases or health conditions that can cause dehydration. So reduced intake or failure to replace water loss, so usually you have impaired this mechanism, or maybe you are immobilized or you are comatose. So that means you lack the ability to replace the loss of water in your body. So the rest usually comes from excessive water loss. So whether excessive water, whether you heat, you are in very hot environment, so you're sweating a lot, so you lost a lot of water. Exercise also sweating a lot, or you are a burn victim. Or kidney function. So kidney involve a lot in regulation of water. So if you have kidney problem, that means you whether produce too much urine or produce not enough urine, or the urine that you produce are not correct. So that means maybe you lose too much sodium or you lose too much potassium. So all of this can happen if you have kidney problem. And also you can lose water from vomiting or diarrhea, or what we call GI tract, gastrointestinal tract fluid losses. So this is not an exhaustive list. There are almost too many causes of dehydration. So this is just the common ones. So what happened to our body when we have dehydration? So the homeostasis response is to increase the total body water back to normal. So in general, you have three main responses that occur in the body. So the first one is when you are dehydrated, it will stimulate the osmoreceptors in the brain. So from the name osmoreceptor, then you know this is detecting the change in the osmolarity, usually of the plasma. So when this occurs, it will stimulate the thirst center in our brain. So there are a lot of small center in the hypothalamus that involve in control of our behavior and function. And one of them is the thirst center. So when we have this thirst center, then we are feeling thirsty, then obviously we will increase our water consumption. So basically we drink more. So this is straightforward. You're dehydrated, the body detected when your plasma osmolarity increases, then something in the hypothalamus will stimulate the thirst center and our behavior change to drink a lot of water. The second changes occur in the kidney. So kidney is the one that produces a lot of urine. So urine output can be controlled based on body need. So when the osmoreceptor is stimulated due to dehydration, it also leads the kidney to conserve more water. So that means the kidney will produce less urine because the body wants to conserve water. So how this happens is through the posterior pituitary gland, which also in our brain. So they release this, what they call antidiuretic hormone, ADH, or sometimes they call it AVP. AVP is arginine vasopressin protein. So they are technically the same hormone, which their function is to decrease the amount of urine produced so that the body can retain water. So you just need to know for course 1, you just need to know this. You don't need to know in detail how antidiuretic hormone function. This you will learn more in your second semester and your fourth semester. So for first semester, you only need to know antidiuretic hormone, reduce amount of urine, and so that the body retain more water. The third one is when we have dehydration, that means that essentially our blood is less because there's less water in blood vessel. So when that happens, we have what we call hypotension or low blood pressure. So when we have low blood pressure, hypotension, it is not good because blood pressure also need to be maintained in the normal range. So usually between 120 systolic and 80 diastolic. So when we dehydrate, when we lose a lot of water, so that means less water in our blood vessel, so the blood pressure will go down. So blood pressure is very important because it is the one that helps the body to distribute the blood throughout the body. So if we have low blood pressure, the blood cannot reach the brain. The blood cannot reach the extremities of your hand and feet. And if our brain does not receive blood, then it will cause a lot of problem. It'll almost stroke-like. So the body must respond very rapidly to increase the blood pressure back to normal. So they have what they call the RAAS. So RAS in full is your renin, angiotensin, aldosterone system. And the important part is the hormone called aldosterone. So aldosterone also will cause the kidney to conserve water and sodium. So when they conserve these two, it will help to increase the blood pressure back to normal. So this is the three main components of response when we have dehydration. Same as the ADH, you don't need to know in detail how the aldosterone increase the blood pressure. You will learn that in the subsequent semester. So usually SEM 2 or SEM 4. So for course 1, you just need to know the surface area. So I mean low blood pressure, the RAS. The RAS conserve water through affecting the kidney to increase blood pressure. So ADH is to increase the water retention. So basically, you just need to know the difference in function of ADH and RAS. So RAS is for blood pressure, ADH more purely on water balance. So those are the three. So if you see here, when you have water input less than water output, so you have your dehydration. So dehydration cause increase in plasma osmolarity, so you increase in plasma osmotic pressure, then you stimulate the osmoreceptor. So when you stimulate osmoreceptor, you have the two, right? So you have the third center, and you have the AVP and ADH. So thirst, so you just drink more water. So ADH, that means you affect the renal, is your kidney. So the kidney will increase water absorption. So this means the body retain more water. So you increase your water balance. The third one, when you have low blood volume, so mean you have low blood pressure. So when you have low blood pressure, it will activate your RAS. So renal angiotensin aldosterone system. So with the effect of aldosterone, you increase renal sodium absorption that leads to increase in water absorption, then also increase the water balance. So these three are the one that you need to know when the body is dehydrated. So dehydrated patient, they can come with many sign of symptoms. So standard one, you have your thirsty, it can be very fatigued, the headache, lightheadedness, dizziness, or syncope. Syncope is almost faint lah. Syncope is faint. So usually this is due to low blood pressure. And sometimes they can present with muscle cramp if they lose a lot of ions, such as your calcium ion, or even your potassium ion. If they lost a lot of ion as well, along with the fluid water, then you can have muscle cramp. Physical signs, dry mucous membrane. I'm sure this one you all quite familiar. Decreased skin turgor, this means the skin will look very dry. And then it lost the skin elasticity. So you can check how the decreased skin turgor, you can check it. And then the other system, you have soft and sunken eyeball, very cool skin, reduced during output. We know renal function to conserve water, then that means you have reduced output. And decreased blood pressure, usually they can also manifest with increased capillary refill time and increased heart rate. So increased heart rate is in response to low blood pressure. So this is the physical signs of dehydration. And the last part for this lecture is dehydration in infants and elderly, and why we are more concerned with these two age groups rather than your normal young adult. So dehydration by age. Dehydration can be a presentation of many common conditions and disease across population. So at any age, you can have dehydration. However, in the very young, such as baby and infants, in the very old elderly population, the dehydration problem can be very severe and the consequences also very severe. Why? Because for in babies and infants, we all know from the very first few slides that infant requires relatively more fluid intake than adults because they have higher water percentage, right? So it's almost 70%, right, from the slide. So because they have higher percentage of water, then naturally they need higher intake relatively to the body weight when we compare to adult. So infant has also higher insensible water loss through skin evaporation because they have a higher skin surface to body volume ratio. So that means for the insensible loss, the rate is very high in babies or infant. So they lose water more from this method. Infants also have higher metabolic rate. So this can also cause a lot of use of water. Water used a lot in the metabolism. And then babies and infants, they lack independence to acquire fluid by themselves. So if you unfortunately have a very neglectful caretaker, parents, and everything, when the child, the infant or baby, very thirsty, if there is no adult there to give them water, if it's occurred long enough or frequent enough, then the child will develop dehydration. Lack of communication when thirsty. So even though they can feel thirsty, baby, they cannot tell directly to the adult that they are thirsty. So if the adult are not aware or does not understand, then the baby will stay thirsty. And if it is occurring long enough, then they can develop dehydration. And then common infant diseases such as fever and pharyngitis, viral infection, they can cause difficulty for the baby to ingest water. So when the throat are very hurt, very inflamed because of pharyngitis and everything, it's very difficult for them to take water, even though it's given to them by their parents. So this is another cause. And the last one is children, infant and babies, they usually can get viral infection. So when they have viral infections as your rotavirus and all this infection that you got, it can cause severe diarrhea and vomiting. So it is very more common in an infant. So this also, the consequences is dehydration. So this is a few causes where dehydration are more common in babies and infants. And also usually when they have dehydration, they are usually more severe. As for in elderly population, there are a few causes as well. So the first one, even though when elderly person is healthy, the advancing of the age naturally will cause a decrease in thirst sensation. So that means if usually in the young adult, they feel thirsty, older people, they are quite less sensitive to the stimulation of the thirst center. So this means that they naturally will drink less water. So when they drink less water, if somehow they have a problem that cause them to lose more water, then they more easily to develop dehydration. The second one, when they are very old, they can have very limited mobility. So when you are very old, you cannot move around as independently. So you lack of independence. So that means even though you are thirsty, if there is nobody around to help you, then you cannot acquire the fluids. So it's almost go back to become an infant after you become too old. So common diseases in elderly population, such as diabetes mellitus or kidney disease. So diabetes mellitus, it have kidney complication, and chronic kidney disease occur in elderly population as well. So this can cause dysregulation in your water balance. So when you have this problem, then you easily get dehydration. And finally, when you are old, you have this neurocognitive problem, such as Alzheimer's disease, then you develop dementia. So when you develop dementia, then you will become very forgetful. Your mental faculty is not as sharp. So sometimes the elderly person, they just forgot how to drink water. They just forgot because they are quite old. Their memory is not as strong. So if this happen frequent enough, then they can develop dehydration. So these are the causes for the elderly population and also in the infant and baby. So there are some overlap there at the core of the problem, but if you look in detail, you know that the explanation is quite different from the infant and to elderly population. So that is the end of the lecture. Thank you very much. If you have any problem, do not hesitate to contact me through the available methods. So thank you very much. I'll see you next time.